Good morning, everyone, and welcome to our time and effort reporting requirements for New Jersey and Connecticut, Part C and D, Community of Practice, Part 2. We're excited to have you on the line today. I know that we're anticipating more people, but we are going to get started. As we're talking about time today, we'll be on time. I'm Samantha Ritter, the training manager here at Health HIV, and I manage our Fiscal Health Systems to Sustainability program. We have a few other experts who are on the line to help us today talk about time and effort. We have Paul Calabrese, a senior manager at Rubino & Company accounting firm, who's our uniform guidance expert. And we also have Jana Collins, who's the research protocol manager for HIV programs at the Bluegrass Care Clinic in Kentucky and is also a HRSA-HAB fiscal consultant. Just a little bit more about Health HIV. We are a HRSA-HAB funded organization that provides education, training, and technical assistance to Ryan White funded organizations on fiscal compliance and sustainability. We design and implement regional trainings and individualized TA. I know that there have been a lot of questions around time and effort, and we're happy to work with your organizations individually to address some of the challenges that you've been having in this area. So just a little bit about the system that we're using today. We have a number of files that are in this little folder icon down at the right-hand corner of your screen. The slides are available for downloading. We have an evaluation link in there. We hope that you fill it out after we're done today. We also have some Excel files. Jana has created some time and effort timesheets, activity recording, whatever word that you would like to use to describe it. And you can download those. We'll be referencing them today during the presentation, and they have multiple tabs, so just look through them. And again, we left them in Excel form in case you want to use them or modify them however you would like. We also we want this to be as interactive as possible. So, if you want, you can type your questions in the chat box below. If you would like to, if you have a long question or if you just would like to participate more, if you look at the bottom left-hand corner of your screen, there's a little purple person. And if you click on it, it says My Status, and there's a hand-raising icon below. And if you click that hand-raising icon, we can see it, and we can unmute you. Right now, everyone is automatically muted, but we can certainly unmute you if you would like to talk. And again, we envisioned this as a much more interactive community of practice. We want to hear about what you're doing around time and effort, what your challenges are, and hopefully people can learn from each other on the call. So that was just the chat box below. And again, we can see it. You can direct message us also. If you want to click on Anna Ludwig, then you can message us directly. So first, before we get started, I'll tell you a little bit about what the format of the presentation is today. First I want to talk a little bit about the worksheet that if folks were on the time and effort part 1, we had asked people to complete a worksheet to address some of their challenges. Did anyone take some time to fill that out, and does anyone want to tell us a little bit about if you thought through some of the challenges that you're currently having, what's preventing you, for example, from taking corrective action or from being more compliant with time and effort? And if you would like to respond, you can type it in the chat box or you can raise your hand. I'll just give you a second. And if you can't necessarily think of anything now, or if you didn't necessarily do it, there is plenty of time during the presentation today to ask questions. And I see someone typing, which is very exciting. We deal with a lot of time and effort challenges, and I think some of the issues that we have, time and effort is a federal requirement. It's not a HRSA requirement, so it wasn't necessarily designed with the Ryan White program in mind. So Ryan White, as we all know, has plenty of requirements, and I think trying to reconcile all of those for folks is quite challenging. And I know that Beth is typing, so we'll wait a little bit for her to continue. And if anyone else wants to hop in now at any point, please do. I'll also tell you a little bit more while we're waiting about how today is going to go. So again, I wanted to talk a little bit about your challenges, just to get a sense also of what we should be addressing on this webinar. Oh, great. So one of the challenges we have is the wide variety of systems and methodologies used to report time and effort. We are unable to provide the financial assistance required to implement consistent technology, and we are somewhat stuck. That is incredibly common. I'm not entirely sure if it's a small organization or a hospital system. A lot of folks are still doing this on paper timesheets. Some people have electronic systems where they can put their time in daily, and I think trying to work in the systems end is definitely a common issue for a lot of people. I'm not entirely sure about what you're using, but we can talk Part A grantee and have numerous subcontractors. Okay, so dealing then with a lot of people who have different kinds of systems, and this is something that we can also help you work with. Is there something setting out kind of in the guidance that you provide to your subrecipients on working with their system? Again, the requirements are the same, so doing it looks a little bit different, but what they need to be able to show should be similar across the board. And that's something that you could also write out in the notice of award and contracts with subrecipients. So we can talk about this a little bit today. It'll come up in some of the examples that we have as well. So I'm going to move along in the sake of time. Again, if people want to join in, please do that at any time. So we are going to review some of the basics from the last community, for the first part where we went over the requirements. And I just wanted to remind people of the fundamentals of what we're really talking about today. So again, this is a federal requirement that comes from uniform guidance, which I think we also have a link to at the end of this PowerPoint if you would like to read it over. So there are just some basic elements that are required for time and effort reporting. Charges to awards must be based on records that accurately reflect the actual work performed. And I think this is one of the most important elements of our presentation today, actual work performed. This is not estimated, this is not budgeted, it's you're going to work and you spend 6 hours doing something and 2 hours doing something else, and that's the kind of thing that you need to write down. There has to be a system of internal controls that reasonably assure that the charges are accurate, allowable, and properly allocated. So some system in place in your organization that you can verify that the hours that you wrote down are the hours that you actually worked. And it has to be incorporated in the official policies and procedures of the organization or clinic. So there has to be, in your policies and procedures, you need to have a written policy about how do you do this. And again, documenting, what kind of supporting documents are you looking for? How would a supervisor verify, for example, the hours that an employee put on his or her timesheet? And these are the basics. And if these systems are in place, then you're compliant. So just, again, in plain language, time and effort procedures must include a review process where employees and their supervisors can make sure that the hours they report are equal to the actual hours worked. So it's great if an employee is writing down the actual hours that he or she worked, but the supervisor also needs to verify that those are the hours worked, because again, we need to ensure that the hours that are charged are the actual hours worked. And there are a couple different ways to think about this. I mean, think if you had a contractor who, for example, charged $1,000 an hour, and that contractor worked for 15 minutes and still charged $1,000 an hour, you wouldn't want to pay. And with federal funds, it's not necessarily that different. If you receive, for example, a certain amount of money to do something, and you have two different funding streams, and you realize that one of them, you're kind of running out of money, but you want to keep doing the work, and so you say, oh, I have some more here, let me move it over, that's not allowed, because, you're kind of, in a way, cheating the funding stream that you're working with. And so this system is basically designed just to ensure that the funds are going to pay for work that's consistent with that grant. And so that's what we're really talking about today. We received a couple questions about time studies, and I wanted to address that before we continued our conversation today. So time studies are not permitted for nonprofit organizations or institutes of higher education. They are only permitted for state, local, and tribal units of government. So there's an important distinction here. Time studies can be used to estimate what kind of budget that you would need. And we need, I think that everyone would probably agree that you don't necessarily know what kind of FTE a staff person should have unless you have a good sense of how much time they're working on a particular grant, service category, et cetera. But that's not, that same kind of time study can't be used for payroll purposes to write down on their timesheets. It's used as a budget estimate, but you need to write down actual hours worked, and I think there is a distinction. I know we had some questions on that, and we're happy to address that more throughout the presentation if anyone has any other questions. Now I'm going to turn it over to Jenna Collins, who has prepared some scenarios to walk us through kind of budget considerations and what supporting documents would be useful in demonstrating time and effort. So Jenna, over to you.
All right, thank you, Samantha. I would just like to start by saying this isn't easy. You know, when Samantha and I started talking about this, these slides and what I've seen as a consultant and doing site visits, I really haven't seen a lot of people doing this well, and because it's hard, it takes time. It takes time to put a system into place that works for the different types of employees that you have on your budget. It takes time to figure out how you're going to monitor it, how you're going to verify it, and so I don't want to oversimplify this as we look at systems and say it's not hard, because it is hard and it's hard to get them going. But what I tried to do is come up with scenarios that I see typically in terms of how people are funded and what types of positions I think would be hard in terms of time and effort reporting, and ways maybe to use systems that are already in place to verify time and effort rather than having everyone sit with a log or a spreadsheet and monitor every 15 minutes of their time. I think for some employees you have to do that, but for other employees I think there are systems in place that you can use to verify their time and then complete a log weekly or daily or whatever works for your organization. So I've just tried to think through some of those scenarios, and like Samantha said, I've come up with a couple tools that I've shared with them, and they've put in the folder of just Excel files that I think would be helpful for different types of employees, and so I'm going to present those today. The pictures on the slide sets aren't great, and so that's why I wanted you to kind of have a hands-on version that you could play with and modify for your own use if you felt like it was a good tool for your organization. So just to kind of reiterate some of the things that have already been talked about, I wanted to talk about supporting documentation that you can use for employees to support these logs. And so I think when possible, we have to be practical. I mean, you're doing time and effort, and you're spending time tracking your time and effort. So I think we have to be smart about what we use in terms of documentation and using things that already exist rather than reinventing the wheel. So that should be a schedule, that reflects actual time work, personnel activity reports, timesheets, etc. Just as Samantha had said, unacceptable supporting documentation includes, estimating or prorating your time based on your patient population or the program budget size, using budgeted or projected figures, and as was mentioned, time studies are not allowed. So we really have to have hands-on materials that we can look at and verify the time that was spent. So for positions that are multiple funded, I think the first thing that you have to ask, and this is what I always tell grantees when I'm on a site visit, how did you come up with this? There has to be a plan that says this is how we came up with this FTE, that we expected this person on this project to work this many hours. And so I think the first thing you have to do when you come up with a budget, like Samantha said, either do a time study or do some kind of small project to figure out what FTE is likely reasonable on a budget. And then the supporting documentation should either support that FTE that you came up with on a weekly, daily basis, or if it's different than the FTE that you anticipated, it helps you bring your budget in line with what's actually happening on the ground, and so you can charge the grant appropriately based on what's actually happening once you have the grant and it's in action in your agency. So I wanted to look at different types of positions that I often see on line item budgets and think about the supporting documentation that could be used to complete time and effort logs. So for billable patient providers, I think those are the easiest: physicians, PAs, NPs, mental health providers. Really looking at like registration lists, arrived appointments, electronic health record notes, billing reports, and using that tangible information. These patients came in, they were seen for however length of time based on the billing reports, and using time and effort that way. That way you're not having to also have a spreadsheet where you're saying, I was with this patient for 15 minutes and this patient for 30 minutes, using reports that already exist to back up time and effort logs that would maybe completed, at the end of the day or something like that. For non-billable patient care providers, maybe medical case managers, dietitians, pharmacists, health educators, if you don't have a template for those type of positions, you may be looking at notes, either in the electronic health record or service encounters in a federal reporting database. How can you use documentation that they are already capturing in order to back up time and effort logs? And, that may be implementing the system in your program where you print out these reports weekly per employee, and you look at, how many of these patients were HIV, how many were non-HIV, if they're supported partially on Ryan White and partially from agency funds. If they're a Part C and a Part D split, how many of these patients served are wiki, how many are not wiki, and looking at separating their hours based on these reports that already exist, rather than having to add a manual log on top of what they're already doing. Because, in the day and age where we live, where it's client level data and reporting, we have a lot of our activity captured. Every time we touch a patient, we're putting the service encounter in, we're putting the note in, and so using those to document and support time and effort logs, I think, are the best use of our systems and our time. I think the most difficult is the administrative staff. I think that information is harder to capture because we're not necessarily seeing patients. We're not necessarily using systems that can clock how much time we were in the accounting system or how much time we were meeting with an employee and providing supervision. So those administrative staffs probably will have to look at time and effort logs. And so I've included an example here of one that I'm actually test driving right now to see if it's a practical way for myself as a C and D and B and A tech supported person to track across cost category and across grants my time and effort. So I wanted to share that as well. So the other thing that you have to think about with time and effort is that you have to account for 100% of the employee's compensated time. So it shouldn't exceed 100% of their time or one FTE, but it should equal out 100%. So if you have a person who's 100% grant funded, that is easy because you can say, we spent this many hours on this grant, this many hours on this grant, and this many hours on this grant. But if you have a person that's split between federal supported projects and non-federal supported projects, you will still have to account for that non-federal time, but it can be a lump sum. So I've included a couple examples in here where you have a person who has some federal support but also non-federal support, and you can just basically lump the hours of non-federal support into one area. That way you've tracked the total time that's spent, and you can come up with hours, based on the full 40 hours and percentages based on the full 40 hours as well.
Jana, this is Samantha. I want to jump in really quickly because we had a question that's directly relevant to this. We have a question that was on, so one person whose example is on the grant for 0.6 FTE, but they are full-time in the organization. The person sees Part C patients throughout the week. Should the person only record work done for the Part C equal to 0.6 FTE? And the answer is no. The emphasis here is really that you have to write down actual hours worked. And part of the reason that you have to write down, for example, federal funds and non-federal funds, so say the person is funded 0.6 or 60% through Ryan White, but if you look at hours worked, that person is actually only working, for example, 40%, and then the funds that are being used to support that person's salary, they're actually not spending the right amount of time on doing that. And so the goal, and this is part of what the challenge really is figuring out exactly how much work that person should be doing, because you do certainly want to be able to support people's salary through what you have budgeted so that you don't have to keep moving things around. So that aspect is certainly a challenge, but you do want to write down actual hours. And part of the reason that we would use, patient or, case reports and workload is to be able to show that that person worked 0.6 FTE on, for example, seeing Part C patients. So just wanted to jump in with that. And again, Jennifer, we have another example on this, someone who's I think partially funded through the agency, so we can talk about it more. Thanks, Jana.
Yeah, great, thank you. So just picking up in terms of verifying and certifying, the reports that you come up with need to be signed by the employee and the supervisor, and have to have suitable means to verify the accuracy of the time and effort reports. So we're not just looking at an Excel sheet that's filled out with hours and signed, but there's also going to be supporting documentation, whether that be workload reports, meeting minutes, some kind of project management tracking that supports what is being signed to say that we certify that this was the time that was spent on the federal project. Sorry.
Samantha, again, just jumping in. Can you talk a little bit about what would suffice as a workload report? And Paul, if you also want to jump in here as well to talk about some supporting documentation, that would be great.
So I would think in terms of a workload report, and thinking from our agency, what we're planning on doing is pulling out of our registration or electronic health record, depending on who the employee is, pulling out the patients that are seen and what their notes look like. So it will be a pretty specific report that has, this provider seeing this patient on this day for this much time, because we want to be able to support who is actually being seen. Are they HIV positive? Are there some non-HIV positive patients that are seen? Are they wiki? Are they not wiki? So I think for the workload reports, particularly for people who are seeing patients, I think need to be specific to the patients and to who they're seeing. Now, when you get outside of people who are not seeing patients, we were looking at using our calendars as supporting documentation and making, most people in our agency are using their calendar for everything, for standing meetings, for scheduled meetings, and particularly it's an example that's coming up with our PI, who is a physician, who's the chief of ID, and she is not going to use an Excel file to document every 15 minutes of her time, but she uses a calendar for everything, and so that's what we were talking about, is building into her calendar. The standing meetings exist. CQM, supervision meetings, meeting with the faculty, going over policies and procedures, those kind of meetings are already there. But as she does other duties, adding those segments to her calendar in 30-minute or hour increments that we can connect back to the grant and use that as workload reports. But I think it needs to be specific enough to say, during this time period, this is what that person was working on, and this is how it connects back to the grant. Paul, I don't know if you want to add to that.
Well, I think you've addressed it very well. And when you're talking about workload, you're talking about specific description of the work performed?
I am.
Okay. Because and in the Ryan White world, that's required. So, let's just stick with that. That's very good. And anything you have that's contemporaneous, that links it back, and you can describe what the work is that you did at that time, that's excellent. That's a good thing to do. I support it.
Thank you. Samantha, you have anything else? Any other questions come in about that while we were talking?
No, that was great. Thank you very much.
So, why we're here today and why we're discussing that is that even though federal regulations tell us that we have to do it, there's really no prescribed form or style of reporting, and that makes it difficult for the question that was asked earlier, where you're a recipient and you have subrecipients that you're monitoring and trying to figure out. There's no one way to do this. But there's dictation on saying this is what you have to capture. You have to be able to account for your time. You have to be able to connect it back to the grant, back to that person's role on the grant. For Ryan White, that means cost categories. Is this a CQM, a support services, an administrative effort? So there has to be an accounting for that. And then the one other requirement is that there needs to be a statement that is signed by the employee and the supervisor that says we certify to the best of our knowledge that the above allocation of time expended performing federal, state, and other program duties is true and accurate. So I tried to add that statement to each of the tools that Samantha put in the folder for me, so that those are kind of built into possible tools that you might want to implement or modify to use for your program.
Hey, Jenna?
Yeah.
This is Paul. One thing, and I don't know because you're the expert on these different parts, but what I've seen with some of the primes, sometimes they'll specify to the subrecipients or the subawardees, they'll prescribe certain forms that they want them to fill out, whether it be a budget versus actual, whether it be a time report. Sometimes, and not always, they'll do that. And the reason they do that is they may have so many subs that they have different forms they're looking at, and at times they may be looking for backup information, and they may just say, this is a time and effort report we would like you to use. And again, that goes back to the original agreement. But it may be something that, you know, they may want to do to get consistency, where they're probably what they're saying is they're seeing different forms, different ways, and it's a nightmare for them maybe, or it's a struggle for them, and they may just want to prescribe, when you work on this grant with us, this is the time form we want to see.
That's perfect. Good point. Thank you. So I wanted to start by walking through our first scenario. And so this is a Part C and D ambulatory clinic that's operated within a university-based hospital system. This is a faculty physician position, and so in this particular scenario, they don't really record time. Typically with faculty and physicians, they record time they don't work versus time they do work. It's recorded monthly. Supervisors really aren't reviewing that information. And so in this scenario, this is a principal investigator that's supported by a combination of Part C and D funds. And so what I wanted to think through again is this person's time. What is the best way to have backup documentation to support any kind of time and effort log that we come up for this person? Again, looking at patient load reports, printing those out either daily when they have clinic or weekly, who they see. Are they seeing all HIV patients? Do they have some general infectious disease patients that they're seeing? How much of their patient load is wiki versus non-wiki? Again, looking at the monthly calendar review, this is an example of the PI on one of my projects, and she is supported by 1,000 different resources, and tracking her time is a nightmare. And so trying to think of what is the most practical thing for her to do that we can use to fill out a time and effort log for her. And so this is just kind of an example of a log that I came up with that we're going to use, that we're kind of test driving right now for this physician. And basically we're putting systems in place with our data analysts to print out patient level reports while this physician is in clinic. So she has clinic on Monday afternoons and Tuesday mornings. So we just kind of did a mock-up of you know, her being in clinic on Monday, seeing 3 hours of Part C patients and 1 hour of Part D patients, and then she also has an administrative meeting on Monday mornings, so we put 0.75 of that meeting with Part C and 0.25 of that meeting with Part D. And so using that to track the hours of time that she puts in, and we filled this out based on a combination of her patient level reports for when her core medical and medical services, and then her administrative time we used her calendar. And so we can put those two pieces of information as supporting documentation on this monthly time and effort log. And then we also accounted for her non-federal funding, for her role as a chief, for her inpatient duties, for the other teaching classes, the other things that she does that are not Ryan White specific. We accounted for those hours as well. And so then we can say this is how many hours for the month that was spent on Part C, on Part D, versus what was non-federal funding. And then that can also verify the percentage of effort. So we can look, you know, for this month, 15% of her effort was spent on core medical, Ryan White Part C, and so we can judge that back against the line item budget, and if it's not correct, then go through the systems, the accounting systems, to bring those into alignment to make sure we're charging her time based on what she's actually doing versus what we kind of anticipated her doing.
Hey, Jenna?
Yeah.
I just want to say this, and I think this is a great system and everything, and unfortunately I hadn't seen this, and I understand that you're saying that the non-federal time just goes into a bucket, but it will depend perhaps on the institution, because some people may have a lot of charge codes for non-federal activities, and they may not, I mean, it just depends upon the institution. They may want to track all those other non-federal, because for them, they want to know what the true cost is to a lot of their programs, even though what you're saying is the minimum is we must break out for federal. But there could be some institutions that want a granular, greater detail, you know, the different projects that are non-federal. Have you seen that?
Sure. I haven't. I've looked at like DOE reports where they separate out all of that a lot more specifically, and maybe that would be a good driver for a tool like that if they have, you know, clinical service being one area, administrative, professional development, you know, their efforts broken down pretty specifically. So that may be a driver in setting up a monthly log on how their actual time is spent in each of those categories. I was just trying to think from a Ryan White standpoint, you know, what would meet the bare bones guideline, but of course, you know, organizations may have more specific things they want to look at, and that would make sense.
That was a great point, Paul. Thank you for jumping in. And I also want to reiterate that even as we were looking for resources to try and pull this presentation together, we encountered a number of universities, for example, that had their own requirements for time and effort reporting. So there are, again, multiple layers in this. There are the federal requirements, there's the Ryan White component, and there might be institutional requirements as well. So just lots of components to be aware of. But thanks a lot for adding that, Paul.
Great, thank you. So some of the recommendations that would, you know, come from scenario one is really looking at how you can track time daily for faculty and physicians, even if they don't have to submit it often. I think that's the key. You know, I was joking around before we got onto the call about, I asked my university, you know, what are you going to dictate for us to do? How are we going to do this university-wide? Because we have a lot of federal grants. We're a small fish in a big pond, and their answer was, you're going to do it on your own, which that's never their answer. So I think, you know, this is up to the program being disciplined to know that, you know, when you have a site visit or because it's federal requirement, this is information you have to track, and whether it is going to be reviewed based on the systems that are in your organization, you kind of have to make that happen. You have to make sure that the physicians and the people who have federal support are tracking this, and that the supervisors are involved in looking at the timesheets and tracking that back to productivity reports to verify that time is worked. So you kind of have to integrate that into maybe what already exists.
And Jana, just, oh, should I not speak?
No, go ahead, Paul.
I just want to say I've talked with a lot of institutions, and you're very right that a lot of these different groups and maybe smaller subset groups within bigger groups, they are often left on their own. And you're right. You have to just, you know, follow the rules, do the best you can, and so forth. It really is kind of unfair. You know, you would think, whether it be, and I've seen these in both hospitals and, like you say, universities, where there's just mega systems, and there could be different grant groups, different all kinds of things that are not consolidated, and it's kind of like they just say, well, here you are, left on your own. It's kind of foolish because, you know, there's single audits and things like that, and you would think they would be very concerned that everybody's on the same page, but in reality, what she is saying is that sometimes certain parts and groups are left on their own to manage themselves, which is really sad.
Oh, Samantha, did you have something you wanted to add?
Yes, we had a question that I think is really great for you to address, Jenna. Do you have a sense of how long, so looking back again at the Excel file that we were talking about on the previous slide, since this is something that you're doing right now, do you have a sense of how long it takes to complete this each month? It looks very time consuming, and we would need to do this for multiple providers. I know this is something that you and I have spoken about in depth, so I wanted to know if you could address this.
Right. So I mean, I think it is time consuming. My hope, I mean, I think it took me about an hour and a half to come up with this for the particular PI. Now, I used her because she's my most difficult, so I would expect that some of the other ones would be a lot more, would be easier because we have 8 other physicians that see HIV patients, but that's all they're paid for is their time in clinic. So that would be looking at their provider, their patient level reports, and I don't expect that to be very long because we were able to automate that process out of some of the reporting systems that we have. And I'm hopeful that it's not going to take me an hour to look at her time once we have a better system in place, because we were printing off calendars and looking at her time and printing off patients, and really this was kind of a first go around of doing that for her. But trying to get our data analysts kind of on board to automate some of these reports per person, isolating HIV patients versus non-HIV patients and wiki versus non-wiki. I feel like we'll be able to kind of move this forward a little faster with her once we have a better system in place. But that's what I said up front. It's not easy, and it's not, I don't want to oversimplify, at least in the beginning, that it's not going to take some time to get these systems in place. But I feel like once we get these systems in place, it's going to be a little more automated and a little more part of the daily routine than it is just starting out. Okay, so moving on to time and effort scenario 2, and I actually use my own personal time, but I know from being out on site visits, I'm a common position to have a program coordinator that is in charge of different programs, and so I wanted to use that as an example because I feel like that it's going to be I'm going to have a difficult time monitoring my time and making sure I can report on this every day, every week, etc. So again, I just used a Part C and D ambulatory medical center operating part of a university-based hospital system. We have an electronic time system, so we verify our time daily. We clock in, we clock out, and that identifies how many hours we actually work on site. We have a timesheet electronically that's signed off by supervisors every 2 weeks. And right now, our budget is charged through a predetermined percentage of effort. So for myself, I'm 100% federally grant funded, but I'm broken out over different projects and across various cost categories based on my job description. So I have some C, some D, some Part B, and ATEC, and then continuous quality management, support services, and administration. And so, from an administrative standpoint, I really don't have a lot to go off of. I have my calendar. I have, the time spent in the accounting system. When I'm paying bills for patients, I can monitor how many of the bills are being paid from the different funding sources. But there's not a lot of systemic ways to monitor my time. And so this is going to, for me, I believe it's going to be a more manual process of keeping track of what I'm doing, whether it's associated with C, D, B, or ATEC, and monitoring that really on a daily basis. I can't, at the end of the day, say, yeah, I spent 3 hours on this grant without kind of monitoring it throughout the day. So I tried to come up with a tool that would be usable for me to monitor my time throughout the day and kind of automate the process. So this one is a little bit hard to see, and I've added that into the folder so that you can kind of use that if you want to play around with it. But basically, I took each of my projects, divided out the cost categories, and made myself units of service that were in 15-minute increments. And so when I'm working throughout the day, like I said, I've been test driving this over the past 2 weeks. As I do projects, I just kind of assign, this is a Part C administrative project, this is CQM, this is, I'm working on paying bills for Part B, and I'm the financial manager for that program, so I put the time and effort there. And so I do this daily, and you'll see on that workbook is there's actually multiple pages. I put Sunday through Saturday in there where there's a spreadsheet for each day where you can go through and assign the 15-minute increments to different projects. And then the last page of the workbook is kind of a summary report that you could use to, give you for the week. These are how many hours I worked on each of the projects for each of the cost categories. These are the total of hours. This is the percentage of my total effort. And then it has that statement that, that can be signed by both myself and my supervisor. Again, I'm still kind of test driving this through the system. It's not terribly cumbersome, to be honest. I keep the spreadsheet pulled up and just put the increments in as I'm doing the work, and then I have it set up so it automatically calculates, you know, the hours over the day that I spend on the different projects and the percentages. And so the harder work, I think, at least from the outset, is going back and comparing that to the budget and seeing if I'm set up appropriately, and if not, making sure that I'm charging the actual hours and percentages that I'm working versus what we kind of expected to happen. So this is what I'm doing from an administrative standpoint. I'm going to test drive it after myself with a couple other administrative employees. But this is easy so far. I'm just, you know, putting incremental time in a spreadsheet, and then it's kind of figuring it all out for me in terms of hours and percentages. Paul,
Jenna,
go ahead.
I just wanted to jump in really quickly. I mean, again, we're talking about things that could potentially be quite onerous, and I think this is a really good example of where training staff would come in. I think the idea is, I mean, in a lot of this, it will kind of be a heavy lift, particularly for a financial administrator, but there is an institutional component for this, that it should kind of be part and parcel of what employees do on a daily basis. And in that way, this is when doing it on a daily basis actually makes it much easier. So it's not like you have to sit at the end of a 2-week period and spend, you know, 5 hours going back to see what you've been working on, but making it part of a regular institutional culture to say on a daily basis, here's what I'm doing, and kind of sharing these requirements across staff instead of just making it one person's responsibility. So just wanted to add that.
Yeah, and I will say, you know, I'm not easily distracted, but some things that I do, you know, will take 30 seconds and then you're moving on to the next thing. And this has actually kept me a little more focused to finish projects all the way through, because I know I'm going to have to account for my time. So that may be just a personal problem, but it has kept me focused on seeing a project through completion so I can get that time entered and be done with it versus starting on something, moving to something else, coming back. It has kept me more focused. It's been kind of an interesting activity. And then just for the scenario two, you know, the final recommendation is just making sure that the budget is actually charged according to the actual hours work and not just based on allocated time. So for time and effort scenario 3, I'm going to kind of back off and make this a little easier. So this is looking at a community-based organization. Again, I'm doing C&D funding just because I realized this call was a lot of C&D funded organizations, and I want to keep that distinction going. But this particular organization uses paper timesheets that are completed biweekly. The supervisor signs off on them. Budget is charged through hours recorded. And so I just have an example of a medical case manager who is 100% federally grant funded on 2 projects. So this is just a medical case manager. They're seeing patients either in clinic, they're doing home visits, they're calling patients, and they have an 80-20 split on Part C and D. So I think, you know, this is a little easier. You can look at patient notes, you can look at units of service, you can have them do a daily report or weekly report. And, you know, as I was thinking through this, our medical case managers have 48 hours to put their notes in. So if you're doing this on a daily basis, you may be missing some of their productivity. So it may be something that has to be done on a weekly basis, and they're closing things up quickly on Friday. But, you know, they can print out service level reports, patients that have been seen, and you can pretty easily identify that the patients are HIV, I would say, because they're 100% federally reported. If not, then you need to look at why this person is serving non-HIV patients, and should they not be 100% federally funded. Their patient load reports can determine, are they WICI, are they not WICI, and then, you know, if you have A and B in the mix, you know, that your patient level reports can include information if the patient's Part A or B eligible, and then also doing a weekly calendar review. So I kind of picture these people being a little more automated, printing reports at the end of the week where you can divide up the hours that they spent based on the actual patient seen, and using their weekly calendar review for, you know, any standing meetings they might have, staff meetings, case conferences, things like that. So I kind of dialed it back to have an easier log for them where the supporting documentation would be attached to this. So you would say, you would have documentation that said on the 6th of this month, 3 hours of patients were equivalent to Part C and 5 hours of patients were equivalent to Part D, and you could back up the hours that were assigned. And I also built into this example non-productive hours. There are a lot of things that you can do with these logs. If you have a timesheet that's organizationally required that does the leave and monitors all of that, I don't know that you necessarily have to replicate that, and you can maybe look at just productive hours and percentages, but I wanted to build that example in where this log is a little easier to fill out, but the supporting documentation is kind of key to verifying how the time and effort was spent. And the recommendation to make sure this organization is compliant is just making sure that the supervisor can verify that the actual hours are worked, so that those productivity reports are attached to the logs that are signed and reviewed. So finally, I wanted to look at one last scenario. Again, we're going to have a community-based organization that's Part C and D funded. They have electronic timesheets that are completed biweekly, and the supervisor signs off on them. Again, the budget is charged based on predetermined percentages, and we're going to use an example of a clinic nurse who is funded at 20% Part C, 10% Part D, and then 70% through agency funds. So I still think that you can use the same kind of support that we were talking about for the medical case manager. Again, you can use patient-level data that's coming either from your registration system, if it's a nurse that's just seeing every patient that comes in the door and doesn't have, say, her own scheduling template. If you take the arrived patients and do a report from there and evaluate those patients, which ones are HIV, which ones are not HIV, which ones are wiki, which ones are not wiki, and use that information to track any time that nurse is actually working in the clinical setting. And then, you could use notes or encounter reports when the nurse is calling patients or meeting with patients outside of the actual clinic structure. If a patient walks in, then you could use the note to monitor those hours, and then again, weekly calendar reviews. So I just built into this log having the funding source. Again, I just lumped other agency funds together, but as Paul said, that would be agency dependent. If the agency wanted to break those down further, that would be something you would have to determine. But this was just the same kind of effort where your backup documentation really supports the hours that are on this log and is what needs to be verified by the supervisor to be in place and to be appropriate. But then the time is just entered on this log and signed off on once a week or every other week to make sure you're in compliance. And again, to kind of close the loop, the budget should be charged according to the actual hours work and not just the allocated time.
And I want to jump in here.
Yep.
Yeah, again, just to emphasize that the importance, again, of someone who is partially agency funded and being able to demonstrate time is if that Ryan White funds can't be used to support that person's salary if that person is seeing more, for example, agency patients than Ryan White patients. And so that person is funded at 30%. If that person's actually only spending 20% of their time on Ryan White, that means that the Ryan White funds are being used to provide care for non-Ryan White eligible patients. And so that's the important thing to be able to demonstrate here. We have a question on what does WICI mean, women, infants, children, and youth. So if you're looking at someone who's Part D specific, being able to demonstrate that the patients are in fact eligible for Part D.
Thanks. Sorry about that.
Can I say something too, just while we're taking a break here? Couple things. One individual had asked about, do we need logs? And the answer is it's just a mechanical thing. So for your university, if you have another methodology, she's just showing you different backup documentation that's useful. It's not so much the document, but some kind of process, that supports. One thing I would just suggest, if you are using logs and then you're summarizing it, auditors or people that come in afterwards, they'll look at the totals to make sure they agree. So when you use different things, they got to agree. So just make sure you're checking it. I know this is a lot of work and so forth, so if it can be, like you say, where you have a spreadsheet and you have a log and then it summarizes, that would help to avoid that. But as a prior auditor, sometimes we look and see the different things, and then we start asking questions. Just thought I would tell you.
Thanks, Paul. And I also just wanted to say, there is no, in the uniform guidance, they don't say that there's one standard method of documentation. You don't have to do a log. You don't necessarily have to do a standard timesheet. You can use an electronic system. They don't prescribe one way of doing this, which in some ways can potentially make it more complicated because it's unclear, what would be compliant and what wouldn't be. But if, again, there are things that you're already using in your university or your clinic or wherever it is, then there are ways to just ensure that whatever you're already doing is compliant. So you don't necessarily have to take on another method of tracking your time if that doesn't work for you.
But what Jana is doing is showing you some practical things, some mechanical processes that she's using if you
Right.
don't have something that will help you and aid you, because there's an awful lot of detail that you're doing, and you're doing little different things, and then you have to summarize it. So if you're not using some, she's got some great examples.
Right, great. And again, if you are using something different and you have questions about, is this okay? Would this be considered compliant? Then again, tell us what you're doing. You can do this on the webinar if you want to follow up with us after. And we're really happy to help work with what you're already doing, because we know that sometimes implementing new systems can be a total pain. So we have one other scenario to talk about. We received a couple of questions about unit or fixed costs and how that works with time and effort. So here we have a community-based organization that does not directly fund staff positions, but salaries are funded through reimbursed costs or units of service. So again, you have employees that do use timesheets based on actual hours, and the supervisor reviews. So our question here is, how does the supervisor verify hours worked? And I would like this to be a little interactive now that we've gone through 4 of these scenarios. Can anyone recommend how the supervisor would be able to verify the hours that this employee worked delivering, for example, treatment adherence counseling? If you want to type your ideas, if you want to raise your hand, we'll give everyone about a minute to think of some ideas. I don't actually see anyone typing. So I guess we'll go ahead, and I can provide some answers. And if you have questions or if you have other ideas, then again, please jump in. But the answer is that it would work exactly the same way. Supervisor uses a calendar, workload reports to verify the hours that were worked. The question here that I think a lot of folks got held up on is, if it's not looking just at a salary, then what kind of reconciliation has to happen with the budget? And the answer is that that would really be a separate process. It's the way that, again, a HRSA site visit consultant, for example, would come in, and the way that they usually start is they would look at payroll, and then they would look at payroll by funding stream, and then they would look at timesheets to see if they actually back all of that up. With unit costs, it's a little bit different, but wrapped up in unit costs, they always involve some kind of staff time, and that figure of what the staff salary, for example, what staff time, that's wrapped up into unit costs. So it's a bit more complicated, but certainly demonstrating time and effort is exactly the same. You have to write down the actual hours that you worked and then use, again, calendar, workload reports, notes on, I talked to this patient for 30 minutes on treatment adherence counseling. Those are the things, that kinds of things that we're looking for. So I just wanted to make sure that we addressed that. And I wanted to, before we open it up to questions, or if people want to talk about some of the things that they're doing, we really summed up here the nuts and bolts of what you need for time and effort. So these are the requirements, and if all of this is followed, then you have a really great system going. So there has to be a budget, again, which would include estimated, for example, FTE and compensation. And we use that estimated budget when we look at that tries to estimate the actual hours worked, but again, knowing that there's a distinction between what's estimated in the budget and then what's actually worked. There has to be some kind of time and effort log. It's a timesheet, time cards. It's something that you're currently doing. If you want to take up another kind of system, then do that. We can help you implement it. And these have to reflect actual hours worked. And this is the most critical part of this presentation. You were talking about writing down what you actually worked and then being able to verify it. So a supervisor has to review once you have your timesheet, your time card, it's signed. A supervisor also has to look at that, because I could just say, for example, oh, sure, I worked for 6 hours today, but on this, Part C, except I actually only worked for 2, and someone else has to confirm whether I'm reporting what I actually did. So that's the supervisor part of this. And again, they can use some of the methods that we talked about: meeting notes, calendars, workloads, all of sign-in sheets, different things like that. There has to be some kind of reconciliation with the budget. And again, this is where some folks have challenges. It's easiest to just on a daily basis write down your actual hours worked. And that way what hits the budget what hits payroll, are those actual hours. And then there doesn't necessarily need to be a reconciliation. But for folks who have allocated, hard time or estimates, then you do need to make sure that the budget reflects actual hours worked and not what's estimated. And then there has to be a step to document time and effort reporting policies and procedures. And again, these have to be written policies and procedures. And this is really helpful to train staff to make sure that everyone is on the same page. I think that was a great recommendation from Paul in working with subrecipients. If there is something that you want them to do, you need to tell them that. And if there's anyone else on the webinar who has experience with this, we would love to hear what you've been doing. And then maintaining supporting documentation for site visits and audits. So if keeping patient workload reports, sign-in sheets, being able to show that, yes, this is what we actually did, that's really important. And we have a question that, either Paul or Jenna, if you want to jump in and answer this, would pay time off like sick, personal, or vacation be recorded on a pro rata basis that corresponds to the budget allocations?
I was wondering if Paul could weigh in on that, since he is coming from an accounting standpoint, I don't know that I am knowledgeable enough about every scenario to be able to comment on that.
Okay. I'll be happy to answer that question. It's a very good question. Basically, your paid absence is kept you do record it, of course, and you record it in total for the day. So if you took 2 hours off, 4 hours off, 8 hours off, whether your entity has sick leave or whether it's paid time off, being vacation and sick, and of course holiday, and then special leave. So you record that on your time report. Hopefully they have a spot, and it's just for the holiday or the time off in total. It is up to the accounting department then to take that. What they'll probably do at the end of either the pay period, bi-monthly or biweekly, or they'll do it on a monthly basis. They will look at all your charges based on your actual hours, and they will develop, percentages, and then they will allocate paid absence accordingly to those grants or whatever. Because most nonprofits are tax exempt, they allocate paid absence as a part of the salary line. They don't put it in their fringe benefit pool. So basically what I'm saying is your responsibility as an employee is only to record. There'll be a box, obviously, or somewhere on your time report to record whatever time you have. You simply record it. Accounting later will allocate it back on a pro rata basis at the end of the month or whatever period they want to do it to the appropriate objective. That's all you need to do is just record your actual, paid absence, and accounting will take care of it.
And I see, Beth, that you added on that, thinking about categories, CQM, admin, et cetera. And again, it would be based on the percentage or allocation of the actual hours worked during that pay period. So that was a great question, and thank you very much for asking that. So does anyone else have any questions, for example, on the time and effort checklist? We have just a couple, we have about 2 minutes left, but I want to make sure if folks have questions that we can address them. And again, this is, I see a hand raised, okay. Okay, so if we have a question, someone raise their hand, and we just granted you Francine, if you want to ask your question.
Hi, I'm new here. I was just wondering if there's a way that I can get access to your webinar, your slide, like on PDF or anything like that. Is there a way
Yeah,
to get that?
We actually have uploaded them into the folder. If you look down on the bottom right-hand corner of the screen, there's a little file icon, and in that we have a PDF of the slides, we have Excels of the tools that we use today, an evaluation, now that we have a minute left, that I'll remind you all to fill out. If you could just tell us, what you thought of the webinar, if there's something that you wish that we would have addressed, that would be really helpful to us. We have a couple of resources here. We have the second link is for, it is the uniform guidance link. If you look at section 430I, that is where personal compensation and time and effort come in. The first is a helpful resource that Jana found that kind of goes through some time and effort guidelines that are more practical than I think the legislation. And just some contact information. If you're interested in some technical assistance in this area, if you have any follow-up questions on time and effort, we know that this is really complicated. If you're doing something well, if you know of people who are doing something well, please let us know. We're really looking for some good models around this. And thank you very much, everyone, for your participation today. Yes, and we'll also distribute the slides and all of the resources to you. If you want to send them around to folks, you are more than welcome. We'll stay for a minute or two to take any last questions. And again, you can follow up with us separately if you have specific questions that you would like answered. And thank you very much for your participation today. And yes, we will leave you a few minutes to get to the slides. We're not exiting out anytime soon.